Hi, my name is Sophia Aronoff. I'm currently a sports medicine 3 student, and for my fifth project, I decided to focus on bariatric surgery and the rehabilitation process behind it. So, for this project, there are three main sections, the first being the surgery specifics and different types of surgery. The second section will be the reasons and qualifications someone will need before going into surgery. And the third section, the most important, is rehabilitation and how a patient is going to actively and safely recover after surgery. We'll be taking a look at exercising, psychological aspects, and eating and dieting specifically. Bariatric surgery enables people who are obese to lose a significant amount of weight. It's said to be one of the most effective weight loss options for people whose obesity is posing as a major health issue. This is very important because obesity is linked to multiple life-threatening diseases such as heart disease, type 2 diabetes, high blood pressure, sleep apnea, and many more. The procedure involves making changes to the digestive system for faster weight loss. People who undergo surgery will experience physical and hormonal changes triggered by the operation. Since there are multiple versions of this surgery, each process is not exactly the same, so it's very important the patient is well educated on each of their options. This surgery is especially complicated as it involves a challenging and lifelong commitment to behavioral changes and more. You'll speak to multiple people like dietitians, nurses, and surgeons before getting the surgery as a patient, and it's required to have many screenings and tests in order to qualify. There are three main options that a patient can go about, such as gastric bypass surgery, adjustable gastric band surgery, and sleeve gastrectomy. Here are the specifics of the three main surgeries. It's pretty rare that a person's medical history will dictate the specific surgery they're going to have. Considering the huge lifestyle modifications the patient is willing to make for this operation, they decide which is best for them while weighing the risks and their goals. There is an incisionless surgery for weight loss, which is referring to the endoscopic methods. These involve a temporary physical change to the stomach to reduce portion size. This is where a balloon is placed into the stomach, injected with saline, which also takes up space, so less fluid can enter. There's also a stapling system where a pouch is stapled from the inside, creating a smaller stomach. The last method involves a synthetic sleeve guided into the first part of the intestine, which alters the chemistry of the gut to reduce digestive enzymes and nutrients. And as you can see, each option offers a completely different result, where 2 out of the 3 options do not require any surgery 5 years post-operation. There are also different results with how much weight loss there is after a year and 5 years. Here are some reasons or qualifications someone will need to get this surgery. First, you must have a body mass index of 40 or over. Since a BMI of 30 is considered obese, having a BMI of 40 classifies as people who are extremely obese and at a risk of serious health complications. You must have at least one chronic medical problem and must be committed to a lifelong change post-surgery. The age range is pretty broad, operating from 18-year-olds to 70. Some risks can include infection, blood clots, excessive bleeding, lung problems, reactions to the anesthesia, gallstones, hernia, acid reflux, and most importantly, death, which is very rare with this procedure. The beginning of rehab is extremely important. Typically, after most surgeries, you will stay in bed for a while in the hospital, but in this case, it's extremely encouraged to get up and start moving. Nurses assist the patient to change their bed position and dangle their feet because this creates a good blood flow. This also enhances the patient's healing. Coughing and breathing deeply also can increase circulation for the patient, loosen secretions, and prevent pneumonia in the lungs. Based on the patient's progress in the hospital, they can usually leave around 2 to 5 days after the surgery. After talking to multiple people before the surgery, people usually know and understand the rehab process they will experience before they even get home. There are really three main types of physical therapy, such as outpatient physical therapy, which is the most common. This focuses on strength, improving endurance, and creates an individualized program to manage weight loss. The second option is acute physical therapy, which is appointed after a nurse identifies a mobility issue in the patient. and home physical therapy, which goes hand in hand with the acute physical therapy. This is where a trainer comes to the patient's house and monitors the progress. It's very important that the patient does not do any heavy lifting of over 20 pounds, and sitting or standing for too long could be very bad for the body. This strategy may help prevent blood clots from forming in the legs. Here's the general rehab exercise program for a patient post-surgery to around 6+ weeks after. It's super important for the patient to exercise because when you lose weight, your body naturally eliminates both fat and muscle. It's important to exercise after this specific surgery so you can preserve your lean muscle. That way you'll keep enough muscle to stay healthy. Plus, it makes the patient feel much better and can maintain their mental health. As you can see, there are precautions, goals, and specific exercises for each phase. Right after surgery, you really don't want to walk for more than 15 minutes, and you really want to focus on not damaging those joints and back. At around 2 to 4 weeks or a month after surgery, you're really learning to build strength and flexibility in the body, and some exercises include leg lifts, shoulder rolls, arm rotations. And around 1 to 2 months after surgery, the patient is focusing on working 5 days a week for 30 minutes, but also keeping in mind that there could be chest pain, tightness, and they really want to focus on some cardio. Around 6 weeks plus after surgery, there are also some of those precautions from the last phase, and they really want to push themselves to burn more calories since there is a more broad range of motion. And some exercises can be lifting weights, squats, sit-ups, crunches, and more. Although bariatric surgery is generally associated with physical changes and quality of life, post-surgical psychological and behavioral changes are much less predictable than the physical changes. It's very clear that the development and experience of morbid obesity is psychologically complex, but not everyone living with morbid obesity opts for bariatric surgery as a method of weight loss, even if they're eligible. There has been a higher prevalence of comorbidities, which could be like mood and eating disorders, psychological distress, and much more after this surgery. Regarding marriage and relationships, only a few studies have examined the impact of bariatric surgery on relationships and marriage. They indicate that the post-surgical outcome most likely just depends on the quality of the pre-surgical relationship. In general, relationships are more likely to improve than deteriorate after bariatric surgery. The first year after surgery is a critical time that must be dedicated to changing old behavior and forming new lifelong habits that will control your weight. In surveys, it's been conducted that certain changes were more likely to be associated with long-term success. These changes include eating, drinking, vitamin supplementation, sleeping, exercises, and personal responsibility. These all go hand in hand with your post-surgical diet you see right in front of you as a patient. These tips are meant to help for around a month after surgery. Eating and drinking slowly is important, chewing thoroughly, no drinks with meals, drinking many fluids, eating on clock versus, so on a timely schedule, and most importantly, avoiding sugary foods, because as we were talking about before, this could be linked to type 2 diabetes, and we really want to avoid that. And these methods will keep the patient on track for their best possible recovery. The diet portion of the recovery is very extensive, so keeping it short, there are around 5 stages of the diet that have a specific schedule depending on the patient. As you can see, stages 1 and 2 begin as early as being in the hospital, which is water and sugar-free clear diets. The third stage, which is low sugar protein-enriched liquid, will begin at home with the patient. And stage 4 is beginning to transition to a specific diet for the person that they will get with a dietitian. Bariatric surgery is a huge, extensive, unique process with multiple rehabilitation areas targeting specific exercise, mental health, and dieting. Thank you so much for watching. If you have any questions about this topic, just email me at that email down below.